parotid region is bounded anteriorly by the posterior border of the ramus of the mandible. So this is the masseter muscles. So masseter muscles is attached on the lateral surface of the ramus of the mandible. So anterior boundary is the posterior border of the ramus of the mandible, somewhere here, with the masseter muscles and the medial pterygoid on the medial aspect of the mandible. So this is the masseter muscle and the medial pterygoid muscles in the medial aspect of the mandible, or the inner aspect of the mandible towards the angle of the mandible. So this is the anterior boundary. So posterior border of the ramus of the mandible. And posteriorly, it is bounded by the mastoid process and sternocleidomastoid muscles. So here we can see the mastoid process of the temporal bone on the skull, and this is the sternocleidomastoid muscle. So this forms the posterior boundary of the parotid region. And above boundary, or the superior boundary, is formed by the external acoustic meatus and the posterior part of the temporomandibular joint here. So the temporomandibular joint here and the external acoustic meatus, which forms the superior boundary of the parotid region. And below, it is formed by the posterior belly of the digastric muscles here, and the stylohyoid muscles, the muscles extending from the styloid process to the hyoid bone. So digastric muscles, posterior belly of the digastric, and the stylohyoid muscles, that forms the inferior boundary of the parotid region. And medially, the styloid process and styloid group of the muscles, means towards the medial aspect of the skull, or towards the medial aspect of the oral cavity in the infratemporal region, is the styloid process and the styloid group of the muscles that forms the medial boundary of the parotid region. So here we can see the anterior boundary, the posterior border of the ramus of the mandible, and the masseter and the medial pterygoid. Posterior boundary, the mastoid process and the sternocleidomastoid muscles. Above boundary, by the posterior part of the temporomandibular joint and the external acoustic meatus, and the below boundary is by the posterior belly of the digastric muscles and the stylohyoid, and medially it is in relation to the styloid process and styloid group of the muscles. So they are the structure which forms the boundary of the parotid region. So the main structures which is present in the parotid region is the parotid gland. Do we have any queries, anybody? So moving on to the parotid gland, as we know, the parotid gland is the major salivary gland, one of the largest major salivary gland, and the others are the submandibular and the sublingual salivary gland. So parotid gland is the largest salivary gland, and the shape is like inverted pyramid. So here we can see the apex, which is directed below, and the base is directing above. So parotid gland is the major salivary gland, or the largest salivary gland, which is shaped like the inverted pyramid. Okay, and this gland is covered by the invested by the inner two and the outer false capsules. Inner two means towards the gland, and outer means outside the two capsule. So the covering is invested by the inner two and the outer false capsule. The true capsule formed by the condensation of the fibrous stroma of the gland. That means the condensation of the connective tissue of the same gland, of the parotid gland, that forms the true capsule of the parotid gland. So this is the parotid gland, which is covered by the inner true and the outer false capsule. Inner true capsule means the condensation of the fibrous stroma, or the connective tissue of the gland itself. And the outer covering is by the false capsule, formed by the splitting of the investing layer of the deep cervical fascia. So deep cervical fascia means fascia of the neck region, which splits in two and it invests the gland. So that forms the false capsule of the parotid gland. That is the investing layer of the deep cervical fascia. Fascia splits and it encloses the gland to form the false capsule of the parotid gland. So this parotid gland is the major salivary gland, the largest one, and is covered by the inner true capsule, that is the condensation of the fibrous stroma of the gland, and the outer false capsule, that is formed by the investing layer of the deep cervical fascia. The superficial layer of the investing layer of the deep cervical fascia is strong, attached to the lower margin of the zygomatic arch. So here we can see the zygomatic process of the zygomatic bone and the temporal bone itself. This is attached in the lower margin of the zygomatic arch and blends with the epimysium of the masseter muscles to form the parotidomasseteric fascia or the parotid fascia. Epimysium means the outer connective tissue of the masseter muscles. That is the epimysium of the epimysium of the masseter muscles, the outer connective tissue layer. So because of the tight attachment of the parotidomasseteric fascia, if there is any swelling in the parotid gland, especially in case of moms, it is very painful. Okay, so parotidomasseteric fascia is the fascia which lines the gland, and it is attached on the zygomatic bone and the epimysium of the masseter. So the fascia in relation to the parotid gland is known as parotidomasseteric fascia or the parotid fascia. Deeper layer is thin and loose and attached to the lower border of the tympanic plate, styloid process, and the mandible. So between the angle of the mandible and the styloid process, the deep layer thickened to form the stylomandibular ligament. So this ligament separates the submandibular gland from the parotid gland. So it is important for MCQ because the stylomandibular ligaments is separating the two major salivary glands. They are the submandibular gland and the parotid gland. So the deeper layer of the investing layer of the deep cervical fascia, it is condensed towards the styloid process to form the stylomandibular ligament, and that separates the submandibular gland from the parotid gland. So that is all about the fascia, true capsule and the false capsule. So the presenting part of the parotid gland. So do you have any queries till now? Anybody? Any queries? Abdul, are you there? Do you have any queries? Okay, are you getting or not? Yes, sir. So move on to the presenting parts, the different part of the parotid glands. Very important here we can see is the apex, which is directed downward. So this is the apex of the parotid gland, and it consists of four surfaces. So they are the superior surface, which forms the base of the gland, superficial or the lateral surface, anteromedial from here towards the medial aspect. You have to imagine the pyramid shape of this gland. Okay, so this is the anteromedial surface and this one is the posteromedial surface. So anteromedial means from the anterior border to the medial border inside this area, and the posteromedial means from the posterior border to the medial border. So this surface from the inner aspect. So it consists of four surfaces. They are the superior or the base, superficial or lateral, that's exposed part, anteromedial from here to here in inner aspect towards the midline, and posteromedial from here to here towards the medial aspect. So that is the different surface, four surfaces. So superior or the base, superficial, anteromedial, and the posteromedial are the surfaces. And it consists of three borders. So they are the anterior border, posterior border, and the medial border. So here we can see the anterior border in front, posterior border behind, and medial border somewhere here in the inner aspect of the gland. So you have to imagine the triangular or the pyramidal shape structure of this gland so that the medial border can be appreciated somewhere here in the inner aspect. So the anterior border that separates the lateral surface from the anteromedial surface. So here we can appreciate the lateral surface and the anteromedial here. So this is the anterior border. The posterior border that separates the lateral surface from the posteromedial surface, and the medial surface, medial border that separates the anteromedial from the posterior-medial surface. So there are three borders: anterior border, posterior border, and the medial border. Medial border between the anterior-medial and the posterior-medial surface in the inner aspect, and the anterior border is this, and the posterior border is here. So they are the three borders of the parotid gland. The apex is directed below. So here we can appreciate the pointed apex which is directing below. It overlaps the posterior belly of the digastric muscles here. So digastric muscles have the two bellies. They are the anterior belly, intermediate tendon, and the posterior belly. So posterior belly is in relation to the apex of the parotid gland. The structure that emerges from the apex are the cervical branch of the facial nerve. So here we can appreciate the cervical branch of the facial nerve, division of the retromandibular vein, anterior division and the posterior division of the retromandibular vein. So they are directed towards the apex of the parotid gland. So talking about the cervical branch of the facial nerve, we discussed before also the facial nerve, when it emerges from the skull, it traverses between the superficial and the deeper part of the parotid gland, and it divides into five. They are the temporal, zygomatic, buccal, marginal mandibular, and the cervical. So this is the cervical branch of the facial nerve, is in relation to the apex of the parotid gland. Sorry. Talking about the base, which is directed above, just below the external acoustic meatus, and related with the external acoustic meatus, posterior part of the temporomandibular joint, temporal branch of the facial nerve, superficial temporal vessels, arteries and the veins, and the auriculotemporal nerve. So auriculotemporal nerve is the branches from the mandibular division of the trigeminal nerve. So they are the structures in relation to the base. So external acoustic meatus, the posterior part of TMJ, temporal branch of the facial nerve, superficial temporal vessels, artery and the vein, and the auriculotemporal nerve. So they are the structures in relation to the base of the parotid gland. Talking about the superficial surface or the lateral surface. So the superficial surface or the lateral surface is exposed on the lateral aspect of the face, and it is covered with the skin, superficial fascia, the posterior fibers of the platysma, parotidomasseteric fascia as we discussed, the superficial parotid lymph nodes, and the anterior branch of the great auricular nerve. So they are the structures in relation to the superficial surface or the lateral surface of the parotid gland. So skin, superficial fascia, platysma, parotidomasseteric fascia, they are the covering, and superficial parotid lymph nodes, and the anterior branch of the great auricular nerve is in relation to the superficial surface of the parotid gland. Superficial means the lateral surface towards the lateral aspect of the face. Talking about the anteromedial surface. So anteromedial surface is grouped by the ramus of the mandible and related with the masseter muscles. Masseter muscles is attached on the lateral aspect of the ramus of the mandible, posterior border of the mandible, capsule of the temporomandibular joint, medial pterygoid muscles in the medial aspect, and branches of the facial nerve. So they are the structures in relation to the anteromedial surface. So masseter muscles, posterior border of the mandible, capsule of TMJ, and medial pterygoid muscles and branches of the facial nerves are there in relation to the anteromedial surface. So if we draw this imaginary line, from the mastoid process. So this is the superficial surface, and this surface will be the anteromedial surface. The posterior-medial surface is related with the mastoid process and the sternocleidomastoid muscles, styloid process of the temporal bone, and the structures attached to it. Posterior belly of the digastric muscles are in relation to the posterior medial surface of the parotid gland. So external carotid artery lodges in a groove on its lower part before it pierces the gland. And the facial nerve, after emerging from the stylomastoid foramen, enters the gland, piercing the upper part of this surface. So stylomastoid foramen is present on the base of the skull. So that is the structures in relation to the posterior-medial surface. Do you have any queries till now? Anybody? Anil, are you there? Anil, so are you getting?
Yes, ma'am.
You have to imagine the structures of the parotid gland, something like a pyramid, okay?
Okay.
So structures within the parotid gland, the structure which pierces the parotid gland from outside inwards are the facial nerve, okay? So the facial nerve in the face, it enters the gland from its posterior-medial surface. So this is the posterior-medial surface, and it divides into the terminal branches. So the terminal branches, as we discussed, are the temporal branch towards the temple, zygomatic branch towards the zygomatic bone, buccal branch towards the lips and cheek, marginal mandibular branch towards the mandible and base of the mandible, and the cervical branch towards the neck, which leave the gland through its anteromedial surface. So it enters from the posterior medial surface and it passes through the gland and it emerges from the anteromedial surface. Okay, so there are the different branches of the facial nerve on the face. And the facial nerve divides the parotid gland into superficial and the deeper parts. So the structures of the parotid gland, superficial to it are the superficial part, and deeper to the facial nerve are the deeper part. And other structure which pierces the gland is the retromandibular vein. The formation of the retromandibular vein is within the gland. So the superficial temporal vein and the maxillary vein united together to form the retromandibular vein within the gland. So formed by the union of superficial temporal vein and the maxillary vein, and ends below by dividing into the anterior division and the posterior division. So this is the anterior division of the retromandibular vein, and this is the posterior division of the retromandibular vein. So next structure is the external carotid artery. It enters the gland through its posterior medial surface. As it ascends, it divides into superficial temporal and the maxillary artery. So here we can see the superficial temporal and the maxillary artery. And some members of the parotid lymph nodes are also located within the superficial zone of the gland. So they are the structures which pierce the gland. So facial nerve in the face, retromandibular vein, and the external carotid artery, and some lymph nodes are the structures which are passing through the gland. So talking about the processes or the extension of the gland. So facial process is the superficial to the masseter. The glandular tissue of the parotid gland which extends towards the masseter, superficial to the masseter, is known as facial process. Pterygoid process between the ramus of the mandible and the medial pterygoid muscle. Glenoid process between the external acoustic meatus and the capsule of TMJ. Glenoid means joint. The pre and the post styloid process, front and behind the styloid process of the temporal bone. So they are the processes of the gland. Facial process, pterygoid process towards the medial pterygoid muscle, glenoid process between the external acoustic meatus and capsule of TMJ. Pre and post styloid process means front and behind the styloid process of the temporal bone. So they are the extension of the glandular tissue known as the processes of the gland. Another important aspect of the parotid is the secretion of the parotid gland, that is the seromucous secretion, especially the serous secretion of the gland. They are carried via the parotid duct and pour into the oral cavity. So the parotid duct is the duct extending from the parotid glands to the oral cavity. So this is the parotid duct. So this parotid duct is 5 centimeter long, emerges from the anterior border of the gland. So here we can appreciate the anterior border of the parotid gland. So emerging of the parotid duct from here, it is 5 centimeter in length and passes forward over the lateral surface of the masseter, so that we can appreciate the masseter gland here, masseter muscle here. At the anterior border of the masseter, it abruptly turns medially and it pierces the buccal pad of fat, buccopharyngeal fascia, and the buccinator muscles. So here we can appreciate the buccinator muscles. So buccal pad of fat, buccopharyngeal fascia, and the buccinator muscles, they are the structure pierced by the parotid duct. So parotid duct is 5 centimeter length, emerging from the anterior border, and it passes superficial to the masseter muscles, and it pierces the buccal pad of fat, buccopharyngeal fascia, and the buccinator muscles. Is obliquely forward between the buccinator and the mucous membrane of the mouth, open into the vestibule of the mouth opposite the upper second molar tooth. So important for MCQ, opening of parotid duct in the oral cavity. So in the vestibule, the upper second molar tooth is the answer of it. Okay, so the oblique course of the parotid duct acts as a valve and prevents the inflation of the duct during violent blowing. So it is the natural protection of the parotid gland, so that the obliquity of the course of the parotid duct, it acts as a valve and prevents the inflation of the duct during the blowing. So that is all about the parotid duct. So other MCQ can be other important question for gross is the structure pierced by the parotid duct. They are the buccal pad of fat, buccopharyngeal fascia, and the buccinator muscles. Okay. So the blood supply of the parotid gland is the external carotid artery and its branches within and near the gland, especially the branches from the superficial temporal artery, maxillary artery, and the posterior auricular artery. So they are the structure, they are the vessels that provides the arterial supply to the parotid gland. And venous drain is by the retromandibular vein and then to the external jugular vein. And the lymphatic drain is to the parotid lymph nodes, jugulo-digastric group of the deep cervical lymph nodes. So they are the lymphatic drainage. Other important aspect of the parotid gland is the nerve supply. So sensory supply is by the auriculotemporal nerve, branches from the mandibular division of the trigeminal nerve. Sympathetic supply by the plexus around the external carotid artery that convey the postganglionic fibers from the superior cervical ganglion, and it acts as a vasomotor. So it is vasomotor to the parotid gland, and parasympathetic is the secretomotor through the auriculotemporal nerve. Secretomotor means it helps to secrete the parotid secretion, that is the serous secretion, and it helps to increase the secretion during the mastication and chewing. So very important SCQ. Parasympathetic secretomotor nerves, it runs as follows. So what is the pathway of the parasympathetic supply to the parotid gland can be the SCQ. So preganglionic fibers from the inferior salivatory nucleus situated in the medulla oblongata, and the fibers run through the tympanic branch of the glossopharyngeal nerve, and it runs in the tympanic plexus and runs via the lesser petrosal nerve and relay in the otic ganglion. And when the fibers are relayed in the otic ganglion, the preganglionic fibers are relayed in the otic ganglion, and then the postganglionic fibers passes through the auricular temporal nerve supply the parotid gland, and it helps to increase the secretion of the parotid gland. So once again, the parasympathetic supply from the inferior salivary nucleus via the tympanic branch of the glossopharyngeal nerve, the lesser petrosal nerve, and relay into the otic ganglia, and the postganglionic fiber passes through the auriculotemporal nerve to supply the parotid gland, and it helps to increase the secretion of the parotid gland. So it is important SAQ. And sometimes we ask in draws also. So all the important aspect of the parotid gland is the applied aspect. Okay, so as we know, the mumps or the parotitis is the common clinical condition related with inflammation, and one is the Freight syndrome. So the damage of the auriculotemporal nerve and the great auricular nerve because of penetrating wound in the lateral aspect of the face. So during the process of healing, the secretomotor fiber of the auriculotemporal nerve grow out and join with the great auricular nerve. So through the great auricular nerve, the secretomotor fibers reach to the sweat gland in the facial skin. Okay, so if there is malunion of the growing nerve, therefore, when the patient eats stimulus intended for salivary secretion, produces the sweat secretion instead. So such complication during the healing of penetrating one of the parotid gland is known as Freight syndrome. This is important. Sometimes may ask in as XAQ. Right, suppose on Freight syndrome. Okay, so if there is any injury in the lateral aspect of the face during the penetrating wound on the parotid gland, so during the process of healing, the secretomotor fiber of the auriculotemporal nerve grow out and join with the great auricular nerve. Okay, so through the great auricular nerve, the secretomotor fibers reach to the sweat gland. So the secretion or the stimulus intended for salivary secretion may produce the sweat secretion in the lateral aspect of the face. So that complication is known as Freight syndrome. So malunion of the nerve can occur, and that condition is known as Freight syndrome. And the patient complains of during the eating of food, there is the sweating in the lateral aspect of the face. Okay, so that is the main chief complaint by the patient, and we have to ask about the previous history of the injury on the lateral aspect of the face involving the parotid gland. Okay, so that is the Freight syndrome. Inflammatory swelling of the parotid gland is very painful due to the unyielding nature of the facial capsule. As we discussed, the parotidomasseter fascia is tightly adhered to the epimysium of the masseter and is also attached to the zygomatic process of the bone. So it is very tightly adhered, and there won't be space for the inflammation of the parotid gland. So that if there is any inflammation in the parotid gland, it causes very painful. So because of the unyielding nature of the facial capsule or the parotidomasseteric fascia. Mumps is the viral infection of the salivary gland, and parotid tumor is the benign tumor. It is painless and does not involve the facial nerves. So the facial nerves are protected in case of parotid tumor also. So that is all about the clinical aspect of the parotid gland. So do you have any queries till now? Anybody? So Abhishek, are you there?
Yes, ma'am.
So are you getting? Do you have any queries?
Yes, ma'am. No, ma'am.
Okay. Amit? So try to draw the flow chart of the parasympathetic or secretomotor supply of the parotid gland. It is important as secure. You can draw like this in a flow chart. Okay. And also important is the Freight syndrome. So do you have any queries, anybody? Dilasa, are you there?
Yes, ma'am.
So, do you have any queries? No, ma'am. Okay. Prince, are you there? So, read about the structure passing through the gland, the parasympathetic supply, and the clinical aspect of the Fraser syndrome. So, they are commonly asked questions. Okay. So, if you don't have any queries, have a good day.